Up next on Primary Care, diabetes management. Knowing how to manage your diabetes is vital to the health of 4.9 million Black Americans who have it. Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, the show dedicated to improving the health of African Americans. Black Americans are disproportionately affected by diabetes. African Americans born today have a 50% chance of developing type 2 diabetes during their lifetime. Additionally, a third of nearly 5 million who currently have the disease don't know it. But as my guest today will tell you, education and lifestyle changes are key to helping us better manage and prevent the disease. Dr. Stephenie Lucas is a Mayo Clinic-trained endocrinologist with decades of experience in chronic disease management and diabetes treatment. She is the medical director of the Diabetes Treatment Center in Detroit and operates her own private practice in internal medicine and endocrinology. Dr. Lucas, welcome to the show.
Thank you for having me.
Dr. Lucas, please explain why African Americans have a 50% chance of developing type 2 diabetes.
There are a number of factors that cause African Americans to have a high incidence of diabetes. Some of them are genetics. If your parents have diabetes, it's much more likely that you're going to have diabetes. Also, the prevalence of obesity in the African American population also predisposes us to developing diabetes. Patients don't realize that in order for insulin to work, it has to bind to receptors. When you have a lot of fat, particularly belly fat, the insulin cannot work, and that causes you to have insulin resistance, which leads to diabetes. There are also socioeconomic factors. There's a paucity of food, healthy food, in many of the African American communities. There's also some evidence that maybe the stress hormone that we produce because of socioeconomic stresses increases our requirement for insulin and can predispose us to having diabetes.
We know that type 2 diabetes, basically the dominant form, but help us understand the difference between type 1 and type 2 diabetes.
There are basically two main types of diabetes. Type 1 diabetes, we used to call it juvenile diabetes because it usually occurs in younger patients. Many people who have type 1 diabetes are thinner, and the cause of the diabetes is that the body seems to produce antibodies against the cells that produce insulin, which regulate your blood sugar. With type 2 diabetes, what happens is that many of the patients have insulin. In fact, sometimes they have a high level of insulin, but they have insulin resistance or they don't have enough insulin for their body. Since we're in Detroit, I often make the analogy that type 2 diabetes is like having a car that has an engine, but it's not big enough for the chassis, for the body. So that many people who have type 2 diabetes do have insulin production, but it's just not enough for what they're trying to, for their body.
So, you know, Stephenie, I'm of a certain age now, and when I was in training in medical school, you know, we shied away from the term or the category of pre-anything, including pre-diabetes, but now this is a disease state in itself. Would you comment on that?
Yes, probably about 1 out of 2 people in the city, adults in the city of Detroit, probably have diabetes or pre-diabetes. Pre-diabetes occurs often as part of what we call a metabolic syndrome, where we have a combination of a toxic cluster of diseases, which include obesity, high blood pressure, high lipids, and impaired response to insulin, or what we call insulin resistance. When you have prediabetes, you're much more likely to develop diabetes. It can be an opportunity for you to wake up. It can be a wake-up call for you to take action, to distance yourself from developing disease. Prediabetes occurs in patients, usually they're overweight, they're not being very active. So sometimes just by losing about 7% of your body weight, and by exercising at least 150 minutes per day, you can often prevent yourself from developing diabetes. We used to think prediabetes was just not a serious disease, but we found that when you have prediabetes, your risk of cardiovascular disease, your risk of kidney disease and eye disease increases. And also there is an increased risk of dementia. And we often ignore this, what we call borderline sugar or touch of sugar, because we don't have any symptoms. So it's easy to ignore, but it can have very devastating effects.
So it's not just an elevated blood sugar, or your blood is too sweet. This is really a substance or disease state, an inflammatory disease state, really, that's causing damage to end organs. Can you talk about some of the things that patients suffer from when the diabetes is not treated properly, not controlled?
Basically, what diabetes does is it can affect the blood vessels, both large and small, so that people who have diabetes, often their blood vessels age at a faster rate than one would expect. So that sometimes you'll see somebody who's 40 years old and their blood vessels will look like they're 60 years old. So patients will look great on the outside, but on the inside their blood vessels may be significantly, have significant damage. It can lead to an increased risk of heart attacks and strokes. It can increase your risk of developing eye disease, and it's the leading cause, one of the leading causes of people requiring dialysis and losing limbs by amputation.
So life expectancy, of course, is shortened, devastating effects on the African American community.
It can be, but there is hope. And this is where action should occur when you have prediabetes to try to prevent these complications. There is no longer a definite requirement that you are going to develop these complications. If you can control your sugar, you can often prevent almost all of the complications that have long been associated with diabetes.
You know, a lot of patients will come in and say, well, how do I get rid of it? We probably should be talking about how do we treat it and control it, and get away from the concept of, this can be done away with at all.
I haven't met anyone who's happy that they have diabetes, but I can honestly say that by having diabetes, many times it does make you become much more in tune with your body and hopefully motivate you to take better care of your body. Many times people with diabetes get regular checkups and they can detect diseases earlier than other patients. They're more in tune with their body. It does not have to be a death sentence. We now have a lot of new treatments. We now have a lot of options and ways to care for patients who have diabetes.
What signs and symptoms can we help people understand that they need to be aware of with this disease?
Probably the classic symptoms of diabetes are, we usually call it the triad, where you drink a lot of water, you pass a lot of water, and you lose weight. Sometimes we'll have blurred vision, you'll have increased fatigue. Basically what's happening is that your body is unable to metabolize the food that you eat and convert it into energy. So you get tired and the sugar gets passed through in your urine. I used to have patients be able to tell me, I know my husband's blood sugar was out of poor control because my feet were sticking to the floor in the bathroom.
In the bathroom, yeah.
And so all of your energy is basically being eliminated. If left untreated, many people can go into coma and it can lead to death. Many women also will notice that they have increased yeast infections. There'll be failure to heal for wound healing, and just symptoms of generalized malaise and fatigue that people may have.
So we made this diagnosis of diabetes in patients. How do we begin treatment?
When we first make the diagnosis, the most important thing that we do is try to modify lifestyle factors. In order for insulin to work, it has to bind to receptors in our body. Muscle has lots and lots of receptors for the insulin to bind to, whereas fat has none. I'm showing this example of fat. This is just 5 pounds of fat, so think of all the extra insulin that you have to get through this fat. Also think of the extra wear and tear that this has on your body as you walk. This 5 pounds impacts about 20 pounds of impact on your knees. This fat is especially detrimental when it's located around your belly. This belly jelly is actually a toxic factory that produces inflammatory agents that increase your risk of heart attacks and strokes and kidney disease. So we have to the first thing that we try to do is to try to intervene with healthy lifestyle factors. That includes a healthy diet. Many of our ancestors, and we owe a debt to them because they made a lot of sacrifices so that we can have the advantages that we had. Many of them worked sun up to sundown, and they were only able to get the scraps from the table. They weren't able, and they needed the energy that occurred when they added fat and other things to their diet. There are very few of us who are now working sun up to sundown, so that we need to modify our diet to reflect our new lifestyle. And we have to try to make an effort to eat God's food the way that God made it, so that if you can find a pizza tree, I'm all for it. But in the meantime, you've got to try to take really good care of your body, because as a famous baseball player said, if I knew I was going to live this long, I would have taken better care of my body. And so making these lifestyle changes will is always our first step. Increasing physical activity may not necessarily help you lose weight, but it will definitely change their body composition so that you will have more muscle and less fat, so that you will require less insulin. So increasing physical activity is a very important component of what we do. Also, stress management. A lot of us are under a lot of stress. We're not sleeping well, we're not eating well, and that contributes to stress hormones being released that are counterproductive to our insulin. And so by relieving stress, that often helps. So I tell people it's kind of like having a wagon with 3 wheels. There's the exercise wheel, there's the diet wheel, there's the stress wheel. And then if you can't get those 3 wheels going straight, then I can intervene with medications. And so the good thing is that we have a whole bunch of new medications that are available to patients with diabetes.
Stephenie, we're going to take a break, but when we come back, in our Black Lives and COVID series, we'll hear from a school counselor who suffered tremendous loss during the COVID pandemic. Stay with us, we'll be right back.
Our dear fellow Americans, vaccines are a huge step forward. We still need to do the simple things that we know work.
Wear a mask, wash our hands frequently, and maintain social distance.
Now it's up to you.
Type 2 diabetes can have a big impact on your life. But how can it be prevented? Well, the first step is knowing if you have something called prediabetes. Take the 1-minute risk test today at doihaveprediabetes.org.
African Americans have suffered a lot of loss during this pandemic, and we thought having people share their stories would help with the healing process. Today in our Black Lives and COVID series, you'll hear from Valerie Folks. Mrs. Folks is a school counselor at Charles Wright Academy in Detroit. She shares how the pandemic has impacted her life.
COVID has affected me personally. I've lost family friends, and when I say family friends, people I grew up with. Morris Hood is someone that was in legislation. Grew up down the street from him, and that was devastating. His best friend, which is my cousin, was in the hospital. And he is a frontline worker. He works in the hospital as a respiratory therapist. He almost died. He was in the hospital for over a month on a ventilator, and we did not know if he was going to make it out. But thank God he did, and he's had 3 to 4 surgeries since him coming out of the hospital. Because I am a clinical counselor and I work hand in hand with doctors, MDs and DOs, I understand and I can read charts. So I understand the ramifications, medical terms of what COVID has done or is doing to the physical body. Now, that's just 2 people, okay? I've had 10 people in my family, family, friends, and family that have succumbed to COVID. So mentally, it has been taxing. Now, as a professional counselor, we have counselors. So any great counselor has a counselor that we can debrief to. And this has definitely been something different for us as professionals. Now, a year out, we're seeing, we're talking to nurses and doctors who are like, hey, even though the world is seeing us come out of it, you know, we're still dealing with the issues of it. So what I mean by that is, we're talking to the doctors and nurses who are still frontline workers, who are still dealing with the first patients who did survive COVID, but who are still dealing with medical issues of it.
Dr. Lucas, we have this terrible disease state called diabetes, and all of a sudden, less than 2 years ago, get hit with this pandemic called COVID-19. How has COVID affected people with diabetes particularly?
Any type of illness has an increased impact on diabetes, patients with diabetes. It often requires that they adjust their medications because sometimes they're not eating, sometimes they require more medication or less medication. And so it's very important that patients, if they do have COVID symptoms, that they do see their doctor. Patients with diabetes have had a disproportionate number of complications related to this COVID pandemic and have had an increased risk of being in the ICU or even dying because of the COVID-19. When your blood sugar is not under control, your immune system is decreased, and it makes it more difficult for you to fight infection. Often also, being overweight can also affect your ability to expand your lungs, and it also can affect how much insulin that your body needs. Many patients also require certain medications, such as steroids, which increase their medication requirement, and so that people who were, for instance, pre-diabetic became diabetic, and also the release of the stress hormones also increased their blood sugar levels. So in general, COVID really had a double whammy on the African American population, or a triple whammy, because first of all, as African Americans, we were more susceptible. If you had diabetes, you were much more susceptible. If you're overweight, you were more susceptible. And then if you had any other comorbidities associated with that, it also increased your risk of developing complications. Also, some of the medications that were required to treat COVID also increased your resistance to the insulin that you might have.
So we have developed a new kid on the block here, so to speak, in terms of coming out of COVID, and people who had pre-existing conditions or diabetes before. They represent a different challenge to the practicing community in terms of diabetic control.
Yes, there are many people now, who have diabetes who never had it before. So we have to treat them and we have to train them. And it requires, the more you know about diabetes, the more you're able to control it. Diabetes is one of those diseases that it really is a very logical disease, but you have to understand it, and you can avoid high sugars and low sugars just by knowing how the medications work and how to adjust your diet and your physical activity. You can achieve control of your blood sugar. But the pandemic has given us a large number of new diabetic patients, and it's very important that we intervene early in patients who have diabetes, because it's been shown that there's a special effect called a legacy effect that means that if you treat people with diabetes well early in the disease, 20 or 30 years later, they have significant benefits and decreased risk of developing certain cardiovascular diseases. So it's very important that patients who do develop diabetes or whose diabetes has been under poor control really seek effective treatment.
So here we are with this diabetic patient, and we know that part of the treatment is knowing what your numbers are. Talk to us a little bit about testing and the methods of testing for diabetic patients, when they should test, and also the hemoglobin A1C.
Yes. Well, I've been around a long while. Fortunately, not long enough that I had to taste the urine to know when a person had diabetes. But we now have the ability to check the blood sugar, and it's very important that you do that, because if you don't know what your blood sugar is, it's almost like you're driving blind. By knowing what your blood sugar is, you know how to adjust your food intake and your activity, and you avoid high and low blood sugars, and you avoid the associated complications. We try to teach patients to not just to check the blood sugar, but to understand what those numbers mean. So just to give you an example, you have the diagnosis of prediabetes occurs when your blood sugar is between 100 to 125. When it's above 126, then you have diabetes. When your blood sugar is consistently above 180, your A1C is usually above 7, and your risk of complications seems to rise proportionately with the elevation in the blood sugar. Previously, I used to have patients come in kind of like what you do with the dentist, where you'd floss your teeth and brush them really well the night before you came to the doctor. And then, but the same thing would happen with my patients with diabetes. The day before they would see me, they would eat the right diet and their blood sugars would be perfect. But now I have an additional test called the hemoglobin A1C. And that test reflects the average of the blood sugar over the preceding 3 months. So sometimes they'll say, well, my blood sugar was perfect, but then I'll see an A1C of 12, which means that the blood sugar was probably in the 300 range. And that means that they are at increased risk of developing complications. So there's an actual correlation between the elevation of the A1C, which is the average of sugar over the preceding 3 months, and the risk of developing diabetic complications. So starting at an A1C of 7, the higher you go, the more your risk of developing complications. So if your A1C, for instance, is 12, then you're about 20 times more likely to have kidney disease, about 12 times more likely to have eye disease, and all of those things. So if I had a pill that I could give you that could make you age faster, you would shoot me. But what this is doing, when your sugar's not under control, it is aging your body so much faster that you are developing complications that you don't need to. And in this day and age, with the treatments that we have available, there is no reason why anyone should develop any complication related to diabetes.
That's an outstanding statement. Stephenie, what should primary care docs be most concerned about when treating their African American diabetic patients?
Primary care doctors should be aware of the barriers that their patients face when treating their diabetes. Diabetes is not easy to treat, and a lot of times we don't always have the time or the empathy to teach patients all of the things that we need to do to take good care of our diabetes. So I think that one of the things that primary care doctors should do is send patients to a diabetes education program so that they can learn what the diabetes is, how to take their medications, how frequently they should check their blood sugar, and they should totally understand the diabetes. Because I have so many patients who don't understand their diabetes, who don't understand the diabetic medications, who are on the same regimen that they were on 5 years ago. And so it's important that primary care doctors who have very busy schedules, because many times, to really explain diabetes to a patient, that's a whole office visit, whereas we are, patients are more concerned about their fingernails or their other things than they are about diseases such as diabetes or high blood pressure or high cholesterol, which are the silent killers which do so much damage to us. If you can treat diabetes well early in the disease, chances are you will have far less complications later in the disease, and good control early in the disease affords even better benefits health-wise when you get older.
The better that we can make friends with patients in terms of helping them control their blood sugar, whether it's through diet or exercise or some of the devices that we have. A lot of people gravitate to those in a heartbeat sometime, and I've seen patients, because of that, really step up and take a real interest in their disease state. Talk to us about a lot of the technology that we now have available.
There's research being done on transplanting cells that produce insulin. There are new devices to deliver insulin. There's new ways to check your blood sugar. In addition, there are a lot of new medications. Previously, all we had was 1 or 2 oral medications that we could give patients, and then we had to give them insulin. But now we have new medications that are available that not only can help treat the diabetes, but can also help decrease your heart risk, can also decrease heart failure, improve your kidney disease, help you lose weight, and have multiple benefits for you metabolically in addition to just treating your diabetes. So that there are a lot of new interventions that can occur that can allow you to take better care of yourself and to prevent complications from occurring.
This is a terrible disease state and something that we really need to step up and begin to apply a lot of the insights that you brought to us today. Dr. Lucas, thank you for being with us today. Our guest has been internist and endocrinologist, Dr. Stephenie Lucas. Thank you again, Stephenie, for joining us.
Thank you for having me.
Given the prevalence of diabetes among African Americans, we must be vigilant in our efforts to educate our communities on how to prevent and manage this serious condition. For Primary Care, I'm Dr. Lonnie Joe.